Hello to the physiotherapists all around the globe. We have seen many patients with meniscal injury. Yes. What is a meniscal injury? Meniscus is a structure present between the two ends of the tibia and the femur. The meniscus increases the joint congruity, it increases the load bearing and improves the efficiency. When we see many a times a small injury on the meniscus, when we see an injury around the meniscus, that is a sign which indicates that the biomechanics of that knee is not very efficient. Yes, why is the biomechanics not efficient and so on? So the meniscus can get injured during a small trauma, fall, or sudden strain or movements that puts an excessive force around the segment. But when there is no fall, trauma, or any other causes, but still you see a meniscal injury in the patient, that means the mechanics of the knee is not very efficient. That means a particular angle there is a little more grind. There can be an instability because of an ACL or PCL injury, which is having a little more hypermobility in particular angulation. If you see the arthrokinematics of the knee, the ACL and PCL is intertwined with one another. Yes, when the knee goes into extension, this ACL and PCL holds one another, and that's where the pivoting movement of the tibia happens. So we call that as the end range locking or unlocking mechanism. Perfect. If you understand the locking and unlocking mechanism, the ACL is a primary driver which initiates the lock and then drives the tibia into rotation. If there is a trauma to the ACL ligament or the PCL ligament, this mechanism is lost, and then there's a lot of grinding around the meniscus. This puts the meniscus in the undue pressure, leading to posterior horn or anterior horn tear based on the loading mechanics. Yes, if you understand the biomechanics of the knee really well, and if you can compare that with the patient's pathology, your level of understanding will improve. So if you want to learn more about this, please follow us and put a like in our page. Thank you very much.